In the past 10 years, there's really been a lot of efforts to increase the awareness about pediatric MS. And I think that pediatricians now are more aware. It's not perfect, but I think that there's more understanding that a child who has optic neuritis or spinal cord involvement and so on is not necessarily having acute disseminating encephalomyelitis. They may very well have their first event of MS. So all the treatments that are on the market for MS are approved for adult MS. All the trials have been done with patients 18 and above. So it has taken a while to actually feel comfortable using these treatments in children because there's not much data about their safety and efficacy in children. For the older disease-modifying treatments for MS, there's now much more data in terms of how the safety is in children. For the newer medications, there's not much. However, now the FDA has requesting to companies about to market new medication for MS that they have to have a plan of investigation in children as well. It's a difficult conversation because by the time we see them, very often they've seen already several doctors, and some of the doctors are not necessarily aware that MS can occur in children, and very often parents have the impression that MS is really a disease of adults. So we have a lot of education to do. We have also a lot of support to provide in terms of helping families to talk to each other, to be able to share, hardships or ways they've been able to convince their kids to take the treatment, or how it has changed their life one way or the other. So it's really nice to foster actually this kind of exchange. Because it's really, when you are an adult patient, you can find other adult patients quite easily with your disease, and there are support groups for patients that often are offered at different institutions, or by sometimes just patients starting their own support groups. But for children, it's because it's more rare. It's actually, you have to take care of the child, but also the family.